When we start looking at this in more detail, we realize that the standard phases typically are described as hemostasis, inflammation, proliferation, and maturation. And we're going to spend some time talking about inflammation for today's lecture. Cells involved in this process, again, these are common to you, or they should be in your knowledge base. The platelets, neutrophils, and macrophages for bioburden control and ingestion of the bacterial killing, fibroblasts, and angiocytes. These cells communicate together by use of growth factors or cytokines, so we're going to discuss that. And then there's a robust cellular activity that takes place during normal wound healing that takes a wound from the inflammatory controlled bioburden phase through granulation, epithelialization, and contraction. And we're going to explore that in some detail here this morning. Here's another example of a patient most of you have seen. A granulating wound, maybe some fibrin and slough. If we do our job, if we address bioburden control and address the other factors at the wound surface here, we may perform a debridement, we may address it with moist wound healing, but if we do our job right, what happens over a very short period of time? The wound epithelializes and heals. And we're going to have a better understanding of those processes at the end of this presentation.
This is the infection continuum from contamination to colonization. Contamination is the presence of microorganisms on the surface without a host response. Colonization is microorganisms on the surface with some local host response or reaction to the microorganisms. A critical colonized wound is actually a local infection, which is, a lot of people will say cellulitis less than 2 centimeters from the wound margins, and a local reaction, host reaction. And then when they develop a systemic host reaction, you actually have frank infection on the wound surface and microorganisms in high numbers that are actually spreading beyond 2 centimeters of inflammation into the next neighboring tissue. Again, we talk critical colonization again, is if you see that, what you're going to see is secondary signs of infection are common, delayed wound healing, usually associated with increased drainage, odor, pain, a local cellulitis greater than 2 centimeters like we talked about, and deterioration of the wound bed with friability, rupture of small blood vessels, increased drainage in the wound, and an odor that starts to develop.
We have one brave soul on the line. We welcome Joe.
Good.
Joe from North Carolina. Hello, Joe.
Hello, Jeff. How are you?
I'm great. What do you do, Joe?
I'm a vascular surgeon. I run a wound center.
Fabulous. Thank you so much for participating today. And what question do you have for us, or comments do you have for us?
Well, I have a question, actually. I'm intrigued by your product, and I'm looking forward to using it. One question I have, which is a follow-up to an earlier question, when someone emailed a question about what happens to the bacteria. I don't think I caught all of that, and I'm not talking about what happens to the bacteria after it's removed, but is the bacteria inactivated in any way while it's on the product, and does that impact when you would remove it?
Right. Well, the bacteria themselves, if you remember from the parts that talk about hydrophobicity, bacteria use hydrophobicity in order to bond to each other, cell wall to cell wall, to form colonies and groups of bacteria in order to protect themselves from the environment, to increase cell signaling so they can form biofilms and other things. When they're bonded to or bound to the hydrophobic material, they actually act as though they're in a colony. So they think they're in a situation where they don't have to divide as rapidly, they don't have to produce as much exotoxin. They can kind of settle down, and some people call it resting or relaxing, but the bacteria they don't divide as fast, and they decrease their activity. And that was shown in a couple of those studies that we quoted. So that's what I think really happens with these, is they bond to the hydrophobic material, they reduce their division, and they reduce their activity, so you get less aggressive bacterial activity. I doubt that they die if they're in a warm, moist environment, and that they're removed in toto by the dressing itself.